Hello and welcome back to Study More Hygiene. In today's video, I want to discuss more about periodontal probing, especially I want to review periodontal anatomy and health. So let's talk first about the gingiva, which is the tissue that covers the cervical portion of the teeth and the alveolar processes of the jaws. So breaking down the gingiva, the first part I want to talk about is our free gingiva. So the free gingiva is the unattached portion of the gingiva that surrounds the tooth in the region of the cemento-enamel junction. It is also known as the unattached gingiva or the gingival margin. So this free gingiva surrounds the tooth in a turtleneck or cuff-like manner. The tissue of the free gingiva fits closely around the tooth but is not directly attached to it. So this tissue, because it's unattached, may be stretched away from the tooth surface with a periodontal probe. The free gingiva also forms a soft tissue wall of the gingival sulcus. It also meets the tooth in a thin, round edge called the gingival margin. So let me point that out here in our picture. So again, our free gingiva will be all this material here. So that's our free gingiva, unattached. And it's on every single tooth, free gingiva. The next thing I want to talk about is our gingival sulcus, which is the space between the free gingiva and the tooth surface. The sulcus is a V-shaped, shallow space around the tooth, and the plural form of a sulcus is a sulci. So the base of the sulcus is formed by the junctional epithelium, a specialized type of epithelium that attaches to the tooth surface. The junctional epithelium forms the base of the gingival sulcus or periodontal pocket. So if we zoom out here, I want to go back to my model. So that gingival sulcus is where that probe is ending up. So right to the bottom, however far down is to the base of that pocket, that is our gingival sulcus. That's where we're getting that probe in there and measuring around. So let me go back to our picture. So now I want to talk about the attached gingiva. So the attached gingiva is part of the gingiva that is tightly connected to the cementum on the cervical third of the root and on the periosteum or the connective tissue cover of the alveolar bone. The attached gingiva lies between the free gingiva and the alveolar mucosa. So in health, the attached gingiva is pale or coral pink. In dark-skinned individuals, it may be pigmented. So the pigmented areas of the attached gingiva may range from light brown to black. The attached gingiva ends at the mucogingival junction where the gingiva meets the alveolar mucosa. The alveolar mucosa can be distinguished easily from the attached gingiva by its dark red color and smooth shiny surface. So let's see here. So based off of our picture, this is our free gingiva. This above it is our attached gingiva going across here. So this is all of our attached gingiva. You can see that coral pink color that was discussed. And then our mucogingival junction would be right here where that color changed from a light pink to a dark pink. So that's our mucogingival junction. And then also discussed was our even darker tissue is our alveolar mucosa. Alveolar mucosa. I also want to talk about the interdental gingiva. So the interdental gingiva is the portion of the gingiva that fills the area between two adjacent teeth beneath the contact area. The caul is a valley-like depression in the portion of the interdental gingiva that lies directly apically to the contact area of two adjacent teeth. The caul is not present if the adjacent teeth are not in contact or the gingiva has receded. So we're talking about our interdental gingiva here. It's on every single area in our oral cavity, so our interdental gingiva. So here's an even more detailed gum tissue pocket. So again, here's that gingival sulcus where that probe will measure into. We have our gingival margin, right where the free gingiva is located that we mentioned earlier. And that's our free gingival groove right there. Everything under that free gingiva is our attached gingiva. And then we have our mucogingival junction where it meets the alveolar mucosa. And again, I have an even more in-depth picture of that sulcus there. So that's that sulcus, like I said, where we measure the gum tissue, and there's the base of the sulcus where we would stop probing. And then there's that junctional epithelium. And I want to talk a little bit further. So a normal sulcus in health, the tooth is surrounded by the sulcus. The junctional epithelium forms the base of the sulcus by attaching to the enamel of the crown near the cemento-enamel junction, or CEJ. The depth of the clinically normal gingival sulcus is from 1 to 3 millimeters as measured by a periodontal probe. Compared to a periodontal pocket, the gingival sulcus that has been deepened by disease, in a periodontal pocket, the junctional epithelium forms at the base of the pocket by attaching to the root surface somewhere apical to the CEJ. A periodontal pocket results from destruction of alveolar bone and the periodontal ligament fibers that surround the tooth. The depth of the periodontal pocket measured by a periodontal probe is greater than 3 millimeters. It's common to have pockets measuring 5 to 6 millimeters in depth. So let me go over to my other picture. So what I just described here. So you have a healthy position of a probe in a healthy pocket and a healthy sulcus. You can see the bone level is intact. Now compared to a periodontal pocket, so that junctional epithelium here compared to the junctional epithelium here, we can see the bone loss and a much deeper pocket. In the second half of this video, I want to dedicate it to periodontal charting on a computer setting. So for example, we can put in the probe depths for a patient. So they were 323, 323. Even you can go, if there's periodontal pocketing, 435. And we can do the same thing on the other side. We can say 435, 434, 434. The next thing I would want to do is measure that gingival margin. Again, we can place that information in there. That's like adding the recession to a tooth. So if there had 1 millimeter of recession here, the clinical attachment level would go up on that tooth. If there's 2 millimeters of recession, the clinical attachment level would also move up. And we can use this to place recession numbers around a tooth. We can also do the mucogingival junction that we discussed earlier. We can add that information. If we measure that and it's at a 6 millimeter mucogingival junction, we can keep track of that across many patients. Other things we can add are things like bleeding. While we probe through, we can go through and click the bleeding marker. And that we can also watch and see disease and how it's going over time. So that's the importance of that. And lastly, we can also do mobility of a tooth. To show how stable that tooth is. So yeah, that is charting in Dentrix.